Hello, everyone. We're glad you could join us for this exciting virtual meetup. It's kind of ironic. We were supposed to have this discussion back at HIMSS 20, and finally, with everything that's happened, the craziness, we finally were able to get back together and have this discussion. And I'm really excited for this discussion about cybersecurity's impact on patient safety and trust. I think that it's changed a lot because of COVID-19. I think there's more attacks, there's more virtual, et cetera. So I think we're going to have a great conversation. And we have a great panel today that can provide some practical insights for you if you're looking at how to secure your healthcare organization and really to build those things that are so important, which is maintaining patient safety and building trust with your patients and your providers or staff. So, without further ado, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'll be moderating this session. We have three great panelists, so we'll go around the room. We'll have each of them introduce themselves. And before we do that, though, I forgot, if you do have any questions for our panelists, be sure to include them in the Q&A section on GoToWebinar. Send those in. Also, we'll be live tweeting the event, so check that out. We'll be using the hashtag HITSM. Of course, we'll be mentioning at Proofpoint, who is our host for this virtual meetup. So if you're on Twitter, be sure to go there, and you'll see a lot of live tweeting of comments and things that are being said. So, all right, let's go around and introduce each of our panelists. Tom Stafford, you want to start us off?
Sure. Tom Stafford. I'm the healthcare CTO at CDW. Right before COVID hit, I was CIO for Halifax Health and switched jobs not knowing that being a CIO would be one of the most difficult jobs on the planet in March, April. I guess March through today even. But on the CW side, I've been able to see a lot of what hospitals need around cyber and stuff. So thanks for having me today, and hopefully I can share a little knowledge of what I've seen across the country.
Sounds good. Is it harder to be a CDW or a CIO? That's a tough question. I mean, it's the pandemic.
Well,
both tough.
It's different, right? There are some things that are harder, but then and I'd say probably the biggest difference for me is I'm not as attached to my phone. When I was a CIO, I had 10,000 users and too many systems and too much data, and all it took was one little chipset to go haywire and everything would come down from a system failure. And you had to worry about the hackers too. And so I'm not as attached to my phone as I used to be. But there's other harder requirements on this side too. So
definitely.
Thanks for asking.
I imagine many that are listening appreciate that attached to the phone comment and the challenges associated there. Cool. Ryan, you want to introduce yourself?
Yeah, I think I'm permanently tethered to my phone, but yes, my name is Ryan Witt. I am the managing director of the healthcare practice here at Proofpoint. I also run Proofpoint's healthcare customer advisory board, and I wear a third hat where I am on the HIMSS cybersecurity committee.
Awesome.
A lot of beer.
Yeah, I always appreciate Ryan's insights. I think we worked together for a long time across a number of different areas, so excited to hear your insights. And then also off camera, I think there was probably one of those security issues with hospital, but we have Chris Conway. He's VP of Chief Information Security Officer at Sharp Healthcare. Chris, you want to introduce yourself?
Sure, and yeah, I apologize. I couldn't get on camera. I had some tech difficulty, but I'm the VP and CISO at Sharp Healthcare. We're a $4 billion health system in San Diego. Been there for about almost 3 years, been in healthcare for about 7. So excited to be here.
Awesome. Glad you could join us. And I think we're going to have a great conversation. Looking forward to it. So Ryan, why don't you kick us off? What are some examples of how a cybersecurity incident really impacts trust on the healthcare organization?
I mean, I could cite several examples. We've seen multiple attacks where probably the poster child, if you will, if you want to frame cybercrime in a poster child sort of way, was what happened with WannaCry. And when WannaCry, that ransomware event took down multiple medical systems and really impacted a health institution's ability to provide care. You want to really dig into that a little bit more. WannaCry was particularly impactful in the UK, United Kingdom National Health System, where they literally had to shut down surgical procedures mid-operation. They had to shut down EDs, ERs. and shift patients to neighboring hospitals. I think there was, couple 100,000 laptops or PCs or workstations that got compromised. Several thousand medical systems got compromised. So, if you think about healthcare, your health institution, how that institution is one of the pillars of your community, and it cannot all of a sudden be able to provide the basic form of care that's needed. It can't really live up to its highest level sort of mission because of a cyber criminal event. That's probably, to me, one of the biggest examples of what we've seen of where a cyber criminal has directly been able to impact the institution's ability to live up to their mission and provide overall patient care.
I think that's a great example. Do you think the coronavirus, because I think it's interesting, you're right, the viruses, the malware, they were the ones that created those widespread events. Is coronavirus creating kind of a similar situation for healthcare where there's, a widespread impact that's happening and multiple breaches because of it?
To me, I mean, what we've seen a lot, and certainly, Proofpoint researchers have talked about this, but multiple researchers have commented on how coronavirus, in particular, has been exploited every which way you can imagine by bad actors, by cyber criminals. So they have launched attacks with the lure being, it's an email-based attack. They're trying to phish or they're trying to steal credentials, etc. But the lures have changed quite markedly as the coronavirus story has changed. So back in the early days, there were imposter-style attacks where people were purporting to have emails come from the WHO, CDC, etc. And it was around FAQ style attacks. Oh, there's this thing called coronavirus, come learn more. And then, but we quickly, as the story evolved and the news cycle evolved, the lures changed. So they went from, hey, you don't have any face masks or you don't have any PPEs. Then you're seeing imposter style attacks where people are presuming to come from a supplier set equipment, and that launches a ransomware attack or launches a malware attack. Then as the story evolved to stimulus checks, or the story evolved to vaccines, the story evolved to, now we're doing telehealth, so come see our new patient portal. So yes, you're seeing every aspect of the coronavirus or COVID being exploited. And that's got to undermine, when you see these very compelling emails that come through, they appear to reflect, accurately what the CDC website looks like, and they're talking about topics that the CDC you would associate with the CDC or the IRS or other institutions. That's got to, and you realize through just a little bit of investigation that it's actually not coming from those institutions. That's just got to weigh on people's psyche, and it's got to undermine their confidence and their trust in the sanctity of that relationship and that system.
Yeah.
Well, it's also a perfect storm too, if you think about it, right? Because as soon as COVID hit, we dissolved the perimeter. 10 to 30% of the healthcare workforce went home, and they went home using different things. I mean, obviously VDI and some of those type of entry points were the safest. A lot of people had to go to the cloud quickly because they had to scale up on something. And then you had folks that were either sick or furloughed from the cyber team, right? So you had all these things affecting you negatively. And all the while, at the same time, like Ryan said, is that the hackers just fed on this and used it consistently and kept changing their tactics along the way because everybody was a little worried and concerned. And when, the human nature side of what we do, when people are uncertain or losing confidence, they're more likely to click on something, and that click can be highly damaging to an organization.
Yeah, absolutely. Chris, what are you seeing at Sharp Healthcare in this regard? And maybe let's take it the next step. What are you doing to kind of combat these, I think we could say explosion of threats and diverse threats and a bigger threat framework with, as Tom said, many people going home?
Yeah, no, I mean, we've definitely seen a move as we had to push a large portion of our workforce to remote. we noticed that hackers try to take advantage of that. How do we, as you're registering and provisioning new access, hackers trying to get involved. Social engineering was higher than ever, especially through email. We saw a lot of those threats as well. How we're combating it, I mean, it's multifaceted, right? I mean, it's the ultimate chess game. I mean, it's education of the workforce. We continue to do simulations as much as it pained us to do, but phishing simulations that were COVID related, and sometimes people get upset about that, but that's what hackers were really doing. I mean, they were they're going to try to exploit wherever they can, and so a lot of focus on training around how to operate at home from a remote work standpoint. So it really just has been multifaceted. I think Tom had said something about the perimeter is kind of going away, and what we're seeing is a focus on the identity being the new perimeter, which is kind of the recent cliche, right? But it really is. I mean, as you start to push people to cloud, from working from anywhere, from any device, you really have to make sure that their identity is who they say they are, and having a solid strategy around identity and access management.
So tell us more about what are you doing? I like the idea of identity as the new perimeter. Is it about a technology? Is it about a workflow? What's your process to ensure the identity of the user?
Yeah, I mean, it starts off as, do you have a good identity proofing process when you first onboard a user? So we work with a lot of affiliate physicians and clinicians, for example, who never come on site. So how do you register them for multi-factor authentication, for example? So it starts with basics of, username, password, good MFA. How do you make sure that they are who they say they are when they register for MFA? Because once you give them that token, that's their sort of the lifeblood of who they are and how they navigate through our systems and our resources. And then from there, it's having a good cloud strategy as we're migrating to Office 365, to other cloud services. How do you control that data using CASBs and DLP? It becomes about following the identity and following the data, and less about how do you lock down the outer wall of your perimeter or set up firewalls. So as that dissolves, it's a totally different strategy of following the data and following the identity. So it's technology, it's process, it's education, it's a multitude of things.
Yeah, and I think it's interesting that you can look at trust from two angles. One is the patient side. So if there's a breach, did you lose the trust of the patient to trust that this information, this email is from my provider? But you're talking about it also from the provider side. And do we trust that that provider should be prescribing that medication or whatever it might be? So I think there's a number of trust angles. Ryan, what are you seeing with as you talk to a lot of your customers, what are they doing to kind of adapt their strategy and their operations amidst the crisis to really be able to combat it?
I mean, we went from a situation where initially, of course, it was all hands on deck, right?
Survival.
People were just trying to survive. I think, I was reflecting about Tom's comment earlier about, wow, my timing was perfect in terms of not having to be a CIO through this. But I think what I've noticed is, I kind of have this personal, what I call my COVID silver lining checklist, right? Which is, there is some benefit you can derive from any sort of crises. And what we've seen here is health institutions in particular who've been able to leverage their desire to go support different technology capabilities, like zero trust, for example, or web isolation, for example, to go help them improve their experience with at-home workers or your business associates, being able to improve your overall ability to interact with them in a secure manner, or their ability now to more comprehensively roll out telehealth sort of solutions. So we went from a situation where the conditions were made a lot easier to roll out telehealth, but that was on a seemingly temporary basis. but that temporary basis is quickly pivoting, I think, to a permanent basis. It looks like we're moving that direction. So there's been a strong embracing of digital health solutions, trying to reevaluate which care models can be successfully rolled out that way, and several hundred, if not several thousand% increase in uptick in telehealth style engagements, and so therefore the investment in all the resources and training and technology to go allow that, and I think by and large a very positive response from the patient community of liking this new experience, and it's not that they never want to return to an in-person sort of engagement with their care team, but they also have we've all recognized that, wow, some of this is actually quite cool. I can be quite impactful and get a lot done on a session like this. So I think that's one of the big pivots we've seen, is that the capabilities and technologies that go allow a successful engagement, whether it's a remote worker or whether it is a remote sort of care experience.
So Tom, how did you, as CIO previously, how do you manage all of that, right? I mean, it's, it's funny, we're talking about your transition, right? But, even before COVID-19, managing, all the IT requests and ensuring security was a challenge, and now it's just exacerbated by everything. So how did you prioritize those things? Interestingly enough, I think the first time I met you about a year and a half ago in one of these nice meetups like this, you said something just so profound that said, I have to do this because it's our patient safety, at the core of what we do. And so we have to ensure security. But, as a CIO, how do you manage all those priorities? How do you approach that?
So how I approach it really hasn't changed. And I know my successors are still doing it. But you're right. As soon as the patient walks into your hospital, you are now entrusted with their data, and you have to protect it. And it's not only just protecting their data, but now we have a whole new threat, which is ransomware, which can shut down your data center just like a hurricane or a fire or a flood or a system failure could, right? So we had to add that to it. And so what I did, and I would still encourage everyone to do, is that you have to look at the threats. Right. So what are the current threats? And, Proofpoint, Ponymon, all these folks help you out so you understand those threats. And then what I would do was I had a philosophy called D cubed, and it stood for deterrence, deception, detection, and third-party assurance. So those are my focus points with the security team. Because at the end of the day, it's a war. You have hackers that want to steal something from you, and they're trying it more socially than ever before. And so I knew the attack vectors, and I would put in as many deterrents as I could between the entry point of the attacker and the golden data. And within those deterrents, I'd add deception points and definitely add detection points wherever I could. And my goal was to frustrate the hacker because he couldn't get in, and he'd go off and hack somebody else at the end. If I knew if I was stronger than everybody else, there was a good chance that they would try and leave. And that took a lot of effort because we would have to layer. We actually created maps of attack vectors and what all of our deterrents were. And always our number one deterrent was the end user. And that still hasn't changed because they're the one that's going to click on that attachment or click on that link that could really cause a bad day for all CIOs and CISOs out there. There's no doubt about it. And that focus point remains. The only difference is now the landscape's changed, and totally agree with Chris. Now it's more about identity than device. And that also makes it very human, right? Because now you're worrying about a person, not just the device they're on. So what other deterrents do you need to have in place around that person's identity and how they're going to react to whatever device they're on? So it's a bigger map these days.
Yeah, and I think what you described there to me is the evolution we've seen of security. That originally it was kind of a compliance thing. I have to be HIPAA compliant, so I have to comply with the law. And now you're kind of describing a shift to more of a patient safety requirement in order to be successful as an organization, as opposed to just a compliance. Is that what you're seeing, Chris? And maybe along with that, is that the conversation that you need to have with leadership in order to get buy-in for your cybersecurity programs?
Yeah, absolutely. I think it's 100% about risk now. Well, I shouldn't say 100%. Obviously, we're a heavily regulated industry, so compliance is always a big component. But when you're talking about the regulators, when you're talking about leadership, the board, at the end of the day, they care about, we don't want to get breached. We don't want to have some sort of insider or outsider threat, something being realized or come to fruition. And so it's, it's an endless game. It's a never, some people will ask, or leadership will ask, when are we done? When is the program done? And the analogy that I'll give is, it's kind of like, painting the Golden Gate Bridge. You start painting and it takes so long that by the time you're done, you're painting it the other way. It's a constant exercise of back and forth because the threats are evolving and the way that we work is evolving, and it's never static. And so you're always sort of evolving with the times and how you layer sort of, defense in depth. It's a Swiss cheese model. How do you have those multiple layers in place? They're always changing. So it's doing an annual risk assessment. It's focusing on, what do you care about most as an organization? What are your risk tolerances? And then going to leadership and saying, this is what the 5 things we really need to focus on. Yeah, there's 100 other things that you could rattle off, but there's only so much the organization can handle. There's only so much money or resources you can throw at something, and you start painting the bridge. And it takes years, and your maturity slowly goes up. And so and then the hope is that as you do that properly, that you are checking those compliance boxes. I mean, you're hitting those compliance areas as sort of a positive byproduct of doing the right thing.
Yeah, and if you do 5 each year, that all adds up. Do you? I don't know if I should put you on the spot here. What's your top 5 right now?
Well, identity and access management is probably the biggest one that we're focusing on, which is why I brought it up earlier. But how you provision access, how do you do it in this new paradigm, and with remote work, perimeter kind of dissolving. So identity is one of the biggest and it's the toughest. It's its own little mini program because there's so much involved with it. And so it's, the other is cloud security. How do you collaborate? So as you move to the cloud, let's say you're going from on-prem file servers to Office 365 and collaboration tools, how do you lock those down? It's a totally different animal than when you have, this castle with a strong perimeter, and you can have a squishy center and you can afford to get away with that. But as the perimeter gets sort of dissolved, then, you can't have that squishy center. You got to have good access management. You got to have, all the policies in place to ensure that your data just doesn't start to just proliferate across the, the internet, that you have control of it. So different paradigm, and those are, I would say, cloud and identity and access management are 2 of the biggies.
Yeah, and I think you and Tom both mentioned the social engineering stuff and doing the simulations and seeing the internal hacking to see if people will open the malware as a training, right? I think that's another good one. Speaking of that, Ryan, this is actually what most excited me about this session was some of the numbers around, I guess they call it business email compromise, right? BEC, or, imposter email. We talked a little bit about it, and I think they're using it as a primary tactic in COVID-19, and they're getting really hard to detect. But obviously, Proofpoint has amazing insights into that. Can you give us some, perspectives on what are you seeing? Maybe the growth of it or the types that are coming. I'd love to hear some perspectives that, you obviously get it across a lot of healthcare organizations. What's happening that, these hackers are doing?
I think we've seen a significant shift on where attackers and cyber criminals now spend their time. If we had this session a couple of years ago, 3 or 4 years ago, we would be heavily focused on classic perimeter style attacks. We would be focused on network style breaches, trying to exploit where patches have not been deployed in networks, 0 days, etc. Those were impactful for one point in time, and not that that problem has gone away, because those problems will never go away.
Necessary.
But those networks have largely been hardened. But what's, I think, more important is it's actually quite difficult to penetrate, to have a level of security or networking knowledge to understand how to penetrate some of those networks. What actually isn't that difficult is to deploy an army of people within your cyber criminal organization to go do some research on Facebook or Google or LinkedIn and figure out what the hierarchy is of an organization, what the various job titles are, what the responsibilities are of those job titles, whether those people are on vacation, whether they're at a conference, etc., who their suppliers are. That takes a little bit of sweat equity, I guess, to use the phraseology, but actually, it's actually pretty straightforward to figure all that out. And so we're seeing a massive pivot to cyber criminals focusing on this social engineering to go try to understand about you, your organization, and to go launch attacks to people on people that matter. And when I say matter, we have this concept at Proofpoint called a very attacked person, which is there usually are attributes about an individual that makes them more desirable from a cyber criminal standpoint. One of the key attributes, of course, is what you would expect would be anybody who's got a high public profile. So whether you are on the hospital board and therefore your name's plastered all over the website, or whether you are a prominent researcher, a prominent clinician, surgeon, whatever. Anybody, if you have a prominent profile, you're probably going to be more attacked. The second factor, of course, though, is do you have access to information that's really interesting to a cyber criminal? So that's almost a counter. So you could be buried in the hierarchy of the organization, but you have access to information in the accounts payable team, or you have access to the patient record, or you have access to research information. That makes you a very vulnerable target. And the
Sounds like the Twitter hack, you know, they didn't go to the high profile, but they went to the people who had access to the back. And
they figured out who had information, who could unlock some of those account profiles on Twitter. That's absolutely right. And the last attribute we look at is who works in a vulnerable way. Not because they're doing anything untoward, but just the sheer nature of their job means they have to interact with cloud apps. They have to go download files. And so they just constantly have to be working in a way that makes them vulnerable. And so the cyber criminals have figured this out, and they tend to focus their attacks on and target their attacks on those individuals because there are things about them that make them more interesting to attack. And so I think that the strong pivot to social engineering and to try to understand where it makes the most sense to go launch their attacks is a significant shift in cyber criminal activity.
Yeah, I mean, as Tom and Chris said, you can't do everything. You know, I still think of the CIO who said, "I'm worried about my 21,000 points of vulnerability," you know, meaning his 21,000 staff, large health system. But you can't secure all of them. So it's interesting that not all of those 21,000 points, to use that example, are created equal. So it's interesting to kind of create profiles to understand who do you really need to educate. And maybe, you know, Tom, you can chime in, and then Chris, I'm sure you have some ideas here. How do you address this? You know, it's so hard to address, you know, thousands of employees who might be exploited with, as Ryan says, very specific information, like an invoice request from a supplier that is the actual supplier that they did research on. What do you do to combat that?
Well, I guess really about three different things. First, the VAPs, we call them internet celebrities, and they were our folks that you know, these BEC types wanted to attack, because if they put enough dots together, they could, you know, form a chain and ask for something, and actually, if it was a good spoof email, could get it. So we educated our internet celebrities more. And one thing too, we educated all of our users, but whenever we educated, we started with their personal lives and explained how if they had cyber hygiene in their own lives, they would better protect themselves. And oh, by the way, do the same thing in Halifax. We're just bigger and have more volume. And so we spent a tremendous amount of time on that, even to the point like when Sherwood got hacked, the hotel years ago, we would send out information on that, even though it had nothing to do with the hospital. And that was our way of knowing that if they saw that email that was all users' email, but it came from the security team, there's probably something valuable in it for them, so they would read it. So we just didn't stop at the hospital. We went very personal. And we also went nation or global with attacks that could have affected them that had nothing to do with Halifax. And when it came to our internet celebrities, we did it more, and we actually phishing tested them more. And that's kind of interesting because it's mostly executives. But they learned to the point that they didn't trust email. And granted, there could be a false positive where they missed something, but in most cases, at the end of the day, they knew how bad it could be if they were to click on something like that. And then lastly is to have partners. Proofpoint saved my butt one night at 4:54 p.m. on a Friday because it was a credential hacking scheme that came through, and their advanced threat protection called us in 4 minutes. And we hadn't heard anything. We saw it happen and started calling everybody to make sure no one was putting in their credentials. And but we wouldn't have been able to resolve the attack as quickly as we did if it wasn't for some extra help. In that case, it was Proofpoint.
Awesome. Chris, anything you'd add to this?
No, I mean, really great points. I agree on the technology. Proofpoint has saved our bacon numerous times in comparison with other technologies I've used. Just absolutely love it. The one thing I'll add is you know, apart from education and not trying to annoy people, but making them aware of kind of the threats that are going on, but especially those types of attacks that affect finance. You know, what kind of processes do they have in place to make sure that if someone does a social engineering attack does go through, that someone doesn't have the unilateral capability to do something significant, you know, erroneously, that there is a check and balance process. We had there's a level of fraud out there in the industry around payers where people will call in pretending to be a provider and saying to the payer, hey, can you change our account number to X, Y, and Z from this other one? And they'll go ahead and change it. And then all of a sudden, all your payment reimbursements are going to a fraudulent account. And so if you had some sort of process in place to where if a payer gets called and says, okay, if someone wants an account change, I need to call these numbers and instead of someone calling into our help desk and getting an account change. So it's a lot of times things as simple as that, is just having good processes. Because the fact is, you know, Proofpoint, I don't care how good your technology is, something will get through. And it's a matter of education and having good process to try to either catch it or deter it in some way.
That's great.
One of the things that we try to talk a lot about is just the recognition that I don't care who you are, what institution, you probably have limited resources, right? You can't have a gold standard for everybody in the organization. It's just not pragmatic, right?
Yep.
So if you have a little bit of an understanding of who's likely to be attacked, like the finance angle, I think that's a really good point that Chris is making. There is almost always a monetization angle to attack. So if you understand a little bit who is being attacked, at least you can start placing some bets, right? You can start placing some bets and say, okay, this needs an extra layer of security, or this needs enhanced sort of training. These individuals need enhanced training, or they need, you know, whatever, multi-factor. Pick whatever control you want to pick. But if you have that little bit of knowledge and insight in terms of where the puck is going, if you want to use that analogy, that can at least give you a little bit of a chance to go, you know, put your extra layers where you can make an impact, and then it helps you at least try to get around I can't cover everything, but I got to play the best defense I possibly can. So.
Well, and, you know, I know you, Ryan, you don't want this to be a Proofpoint commercial, but you guys offer a product like that, right? That analyzes the email and tries to understand who the biggest threats are. Is that right, or am I remembering wrong?
No, yes, we place a lot of emphasis and focus on threat insight and threat intel. In fact, we did a study of what we call large health systems. So we're pretty granular in how we view the healthcare marketplace. And for us, a large health system is more than 10 hospitals. Okay. And so we studied how cyber criminals were attacking large health systems from the beginning of the year through the end of April. And we saw marked differences in the geography of attacks. So those health systems that were in, say, the Northeast, the kind of ground zero of
Sure.
COVID, at least back then,
Right.
were most heavily attacked by a exponential factor. I think the most interesting thing we found, and candidly concerning and quite heinous to be blunt, is the pivot of how the attack changed. So at the beginning of the study, the people who were attacked are what we expected. It was the administrators, it was executives, it was people in accounts payable, IT organization, the people you expected to be attacked. By month 4 of the study, just about the most attacked department in the whole health system. This is a health system now who has 50,000, or these are health systems, we have 50,000 plus email domains. Just about the most attacked department was the hospice organization.
Wow. That makes sense, though.
Right. So, and I guess, the conclusion we were kind of drawing to is well, I guess the cyber criminals were trying to follow the news cycle and presuming that at this point in time that would be a very active part of the organization. Now, I don't like to think about the implications of that. I find it, these people are on the fast track to hell as far as I'm concerned. But it is if you understand that that's who's being attacked, at least you can do something about that. So that's probably in most health institutions not a place that you would see as many controls compared to the hospital board, but at least if you saw the puck go in that direction, then you have an ability to say, okay, we're going to do something about that, because those people have access to the patient record, they have access to controlled substances, et cetera. They're probably not used to being attacked. So it gives you an ability to at least play some of your cybersecurity bets.
Yeah. I saw on Twitter someone tweeted recently that just today, I think I saw this morning or maybe last night, they said that they thought that if someone breaches, say a ransomware or malware incident, takes your system down and people die, that they should be held accountable. And I think that is what we're talking about, whether that's a good criminal procedure or not. Unfortunately, that is the impact. So I think this conversation is really important. To Chris's point, though, breaches are going to happen, right? I think we all have come to that conclusion. So let's finish this off in our last few minutes and kind of talk about how should an organization respond to a cybersecurity incident to kind of minimize that loss of trust with your providers or with your patients. Maybe Chris, then Tom, and then we have Ryan wrap up.
I got a quick thing on that is before you do get breached, because you're right, it's not if, it's when type of thing, way the world's going today. But IT leaders have to have a really good relationship with their cyber insurance carrier. You should have their 1-800 number in your cell phone. And the other thing you should do too is, in most cases, your cyber insurer will give you 10 firms to do IT forensics and come in to help you clean up. And you should pick a few of those ahead of time. So that way, at 3 o'clock in the morning when this happens, you already know who you're bringing in and you have some relationship with them. And the other thing is to make sure that your logs are off-site, because if you get ransomed and you can't get to those logs, it's really hard to do cyber forensics around those. So I think that's important. And the reason why you want to have all that in place, because you want to be back up as quickly as you can, because today we're so reliant on our electronic systems in healthcare. And we just got more reliant because of COVID. It's digital first now, and we're doing more things digital. And when these systems go down, it directly affects patient care because the caregivers don't have the information that they're used to having all the time. A nurse can still care for someone, and it's never going to affect how they care for someone, but they don't have the intel they need because they're used to seeing it in the computer, and now they can't get to that computer. And so obviously downtime procedures and all that come into play. But knowing your cyber insurer and the forensic teams ahead of time at least will hopefully help you get up sooner to limit damage.
Good advice. Chris, anything you'd add?
No, that's good. I would say from an incident response perspective, practice. It's something that our team does on a regular basis, simulating attacks, how we respond to them, how quickly, because it is going to happen, as you said. It's how quickly you can contain and evict a threat. And then, of course, being transparent with your leadership. The thing that you're seeing in the news, for example, with Uber and other things, that's obviously the thing not to do. But I would also say it's also about involving the business cross-functionally in your incident response exercises or tabletop exercises. So, for example, we did one last year about ransomware in our lab systems, and we talked through it, and it was very enlightening for the business to see, and for us to see, what are the types of decisions we need to make operationally if you have downtime? And so it's not just an IT thing, it's a business thing, especially with ransomware. And do you have your decision team ready to make those decisions? Is it, hey, we want to pay the ransom or not? And so you don't want to be scrambling to try to set all of that up. If and when this happens, you want to have that dialed in. And I think it's how well you respond that's going to make the difference.
That's a great idea.
I totally agree with.
Go ahead, Tom.
I was just going to say, I totally agree with Chris on that. And the nice thing about those tabletop exercises is it's really involving executives and stuff, so you don't have to really shut down a floor or anything like that. It's all, I'd say, make-believe, but getting the right people in the room and even like marketing of how are they going to start, rebranding this and getting it out to the public. And like Chris said, you need to do that before it happens. That way, when it does happen, you can reduce the effects of what's occurring. There's no doubt about it.
And my guess is when you do that exercise, you're probably getting buy-in from the executive leadership and, I mean, for lack of a better term, scaring them into funding more work on this because they don't want to go through that if they've been through it.
Oh, yeah. Absolutely.
Yep, absolutely. Great. Well, we're at the end of the time. Ryan, any final thoughts to wrap us up?
Yeah, I mean, I think Chris and Tom made a lot of really good points there on your last question. I think what I want to add is come at it from a completely different sort of point of view, which is if we think about how this potentially could evolve, right? How we are not going to move away from telehealth and these sort of remote engagements being just kind of a point in time, that it's going to become a new norm. And how important, therefore, is it for a health institution to be able to foster and develop and create and maintain these relationships in a remote way? I mean, let's face it, you're a patient-clinician, patient-doctor relationship is just about the most important professional relationship you're ever going to have. And through the moment in time until now, you've basically been able to foster and develop those relationships in a kind of eyeball-to-eyeball sort of way. Now you can't do that. So now you need to rely on other ways to go developing that sort of trust and developing those relationships. And I guess I would argue, or I want to make the point to say, if you drop the ball from a cyber standpoint, data breach standpoint, how can you maintain or develop these net new relationships going forward? And how easy will it be for a patient to maybe go choose a different sort of provider? So yeah. I think as we get into these new care models and digital health becomes very much the norm in terms of how we interact with our care teams and our primary caregivers, I think the importance of building out a cybersecurity strategy that can support those sort of engagements have never been higher. And using some of the exercises that Tom and Chris talked about in terms of how do you interact with your executives or your hospital board to get them to understand that connection and get them to understand that this underpinning of the cybersecurity posture is critical to go drive these new care models going forward. So you can maintain that trusted relationship, I think is essential.
That's a great point. With telehealth, I can go wherever I want. So there's a lot more competition. So you better build trust with me or I'm going to go somewhere else that I do trust. So great way to wrap it up. And thanks for all your insights and perspectives. Thanks everyone for watching live. And obviously a big shout out to Proofpoint for sponsoring this virtual meetup. We appreciate that. And you can definitely check out more at proofpoint.com. Check out all their info and the solutions they offer healthcare. Interestingly, it was the very first purchase I ever made as an IT guy out of college, when my first job was at Proofpoint, it was the first company I bought. So, 15, 20, I guess we're almost 20 years later, we're here talking about it. So thanks for everything you've done, and thanks everyone for participating. If you want to find the recording of this and other great healthcare IT content, be sure to check it out at healthcareittoday.com. Thanks, everyone. Have a great day.
Thank you.